A lovely day again. Glad you could make it to join us. My name is Mr. Teacher. Here with me is...
My name is Mommy Gross. How are you all doing?
Today we would be looking into the functional anatomy of the respiratory system. Mommy Gross, you'll start.
Respiratory tract, or tree, this is the anatomical structure through which air moves in and out of the lungs, and consists of nose, pharynx, larynx, trachea, bronchi, bronchioles, terminal bronchioles, alveolar ducts and alveoli. This is subdivided into upper respiratory tract, nose, pharynx, and larynx, lower respiratory tract, trachea, bronchi, bronchioles, terminal bronchioles, alveolar ducts and alveoli. The trachea bifurcates into two main or primary bronchi called right and left bronchi. Each primary bronchus enters the lungs and divides into lobar or secondary bronchi. These secondary bronchi in turn divide into segmental or tertiary bronchi. In right lung, there are 10 tertiary bronchi and, in left lung, there are 8 tertiary bronchi. The tertiary bronchi divide several times with reduction in length and diameter into many generations of bronchioles. When the diameter of bronchus becomes 1 millimeter or less, it is called bronchiole. Terminal bronchiole continues or divides into respiratory bronchiole, which has a diameter of 0.5 millimeters. Functionally, the respiratory system is divided into conducting and respiratory zones. Conducting zone, this zone consists of nose, pharynx, trachea and the bronchial tree up to 16th division, called the terminal bronchiole. The trachea divides into 2 bronchi, which again divide and redivide 23 times. Bronchiole starts from the 4th division. Up to 16th division, there are no alveoli. So this does not take part in gas exchange. This constitutes the bronchi, bronchioles and terminal bronchioles, being the 16th division. Respiratory zone, beyond the 16th division a few alveoli are present on their walls and they are called respiratory bronchioles. These lead to the alveolar ducts, whose walls are composed entirely of alveoli, and finally to the blindly ending alveolar sacs. As gas exchange takes place from the 17th to the 23rd division, this portion of the lung is called respiratory zone. There are about 300 million alveoli in humans, with the total area of the alveolar walls in contact with capillaries in both lungs about 70 centimeters. The alveoli are lined by 2 major types of epithelial cells. These are type 1 cells, which are flat cells with large cytoplasmic extensions, are the primary lining cells. Type 2 cells, granular pneumocytes. Type 2 cells are thicker and contain numerous lamellar inclusion bodies. These cells secrete surfactant. Other cell types may be present. The lungs also contain pulmonary alveolar macrophages, PAMs, lymphocytes, plasma cells, amine precursor uptake and decarboxylase, APUD, and mast cells. By this point Mr. Teacher will have to take up from me.
Hope you guys are understanding what we're trying to communicate. Bronchi and their innervation. The trachea and bronchi have cartilage in their walls, but relatively little smooth muscle cells. They are lined by a ciliated epithelium that contains mucus and serous glands. Cilia are present as far as the respiratory bronchioles, and their walls do not contain cartilage. However, their walls contain more smooth muscles, of which the largest amount relative to the thickness of the wall is present in the terminal bronchioles. The walls of the bronchi and bronchioles are innervated by the autonomic nervous system. Muscarinic receptors are in abundance, and cholinergic discharge causes bronchoconstriction. The bronchial epithelium and smooth muscle contain beta-2 adrenergic receptors, many of which are not innervated. Some may be located on cholinergic endings, where they inhibit acetylcholine release. The beta-2 adrenergic receptors mediate bronchodilation and also increase bronchial secretion, while alpha-1 adrenergic receptors inhibit secretion. There is in addition a non-cholinergic, non-adrenergic innervation of the bronchioles that produces bronchodilation. Thank you for your time. We do this again tomorrow. Have a nice